annual medical screening. Annual mean yearly. Annual mean yearly. That is at least one every year. At least every year you dey do test. E no mean say you dey do screening. E no mean say you must dey sick. E no mean say something must dey do you or do everybody for the house before you go do am. Wetin e mean is that every year you just carry yourself go hospital make dem run some screening for you based on your age. E no mean say you must dey sick. E no mean say anything go dey do you before you go for this annual checkup. Because it's a norm, na me dem dey call am screening. So and also I believe say na because of how the situation for our country Nigeria be, wey be say na out of pocket na we dey do everything wey concern health, na make e dey a little bit difficult. Outside Nigeria, outside the country, the western world, wey be say most of the health things we dey do, if once you get their NHIS or so, you are able to get all this screening done. And yes, you dey pay, but you dey pay small small with time. So you get all this screening done, and they always put am, e be like routine thing for them. They go tell you where you need to come for your next routine screening test. So now, so all those ones they do their own, and I think it don't reach time when we even in Nigeria should have something like that where we go feel put in place. Say when the people come for screening, we can actually tell them to come so time for a continuous screening. When we say medical screening simply means doing some investigation or not to get a diagnosis, but to find out something, to find out whether you get any problem or not. So screening is not like treatment. No, screening is just to find out. Is to find out. That's might use that and the simple method word when I feel use. Then that to find out something about person, whether it they good or bad. So that if it they bad, we will quickly know what to do. But if it they good, we will also quickly know what to do. So that's what this screening be. So when we now talk annual medical screening, it means say person they come do this screening, come check himself at least every year. But as I earlier said, there are some disease states or some condition when we say you don't need to wait for every year. There are some condition when we say now every 2 years now you they do the screening. So it now depend on the condition when person they look into. And not be everything that they screen. Most of the diseases when they screen are mostly chronic diseases. Those things where if give you chronic diseases. Now, when we do hypertension, BP, those ones are still screening because we know they go find you whether you get BP, but we just check. So when we do anything like we just check this person they fine, but we just check this particular thing. And those are the annual screening. So when we don't check anything what we see, we go feel use and talk or an act concerning that person. So when they talk about screening, it not mean say you need to use all the money when you get. Let me come to Nigeria situation. It not mean say you need to use all the money when you get to do screening because there are small things when you feed do as screening. I remember I say checking of your BP. They are part of screening. They call them vital signs. All those vital signs you check, they are part of screening because they fit even tell us something that is going on inside your body, and those one feel lead us to do other investigation or other tests to find out if there's other things. So, but that one, those checking of BP don't need to be done once a year. No, but I just use that one as a case study because they are still part of uh, doing screening. So doing your blood work once in a year, it's not bad. You check your food blood count, your sugar level, your kidney test, liver test, cholesterol, that's fatty liver and sorry, not fatty liver, fasting lipid and all that. For the men when don dey pass 40 years, you come dey do your PSA. For women, you dey do pap smear. I know pap smear is done once in every 2 years though. Pap smear, and just like that, you dey do all these tests at least once a year. It means say you dey do screening. As I said, not be say you dey sick but you just want to know how fit you are. So as we dey grow old, we supposed to dey do this test to know how fit we are, because e dey very very important. So wetin be the importance of doing this um, annual medical screening? What's the importance? So one of the importance of it na it dey lead to early detection of disease and diagnosis, early detection and treatment of disease state. So e get some disease wey be say if you quick know say you get am, e can be treated. We go fit handle am well and on time. And because when we handle them on time, we go fit cure them. But if you not dey do this, and most of these disease are still things that will not show themselves. They will not tell you say problem dey. When you test yourself, it can be a baseline to know if there's anything for anything wrong with you. When we talk that one, we talk say if be say you go fit be say na one of the things where you fit quickly detect if you get any health issue or not. So that if you get any health issue, quickly we go quick take care of them. Because we know say most of these health issue they fit not get signs and symptoms. And because they not get signs and symptoms, sometimes most people they can't find out when the thing don't affect them well well. That's one of the benefits. Another of the benefit I be say when you want travel, sometimes you need all these things, all this medical checkup as a guide to take pass one point or the other. And then it come me say you go need to do some immunization and all that. Eh? And before you take some vaccine self, you need to do some tests. One na hepatitis. Hepatitis test can just be a screening test for you as well. So if you can see say you know dey positive to hepatitis B, you can actually take the vaccine. So it will make you know when to take vaccine and what to do. Also, another one is that it will still help us know how to reduce our. It will also help us to save our finance. And it will also help us to save our finance. What I mean be say, if you quick know of something, and the money when you go take treat that thing go small pass when you not quick know of the thing. So it will help us manage our finance as well. And apart from our finance, every other of our resources, even human resources, it will also help us manage am. Because when they know something on time, you may not need admission. It fit be something where you go just need to waka enter the place and they treat you and you come out. But when you know late, that one fit come affect both your social activity, your and psychological activity and otherwise. So these are some of the few benefits when I think say I fit remember.